What is HPV? Human papillomavirus, or HPV, is the most common sexually transmitted infection in the U.S. and may cause cancer in the head, neck, cervix, vagina, vulva, penis, or anus in higher-risk patients. HPV screening. How do I prevent cancer? Close surveillance and screening can decrease your risk of developing cancer by more than 50%. Anal cytology, or anal pap smear, is when a swab is put into the anus to collect a sample of cells, which are viewed under a microscope to see if any cells look abnormal or precancerous. This is similar to cervical pap smears for cervical cancer. High-resolution anoscopy, or HRA, is when a magnifying scope is used to look at the anus and surrounding skin to see if the tissue looks abnormal. Since higher-risk patients may become long-term carriers, patients often need to come back for ongoing monitoring. Why am I here? Chances are a prior clinician may have detected HPV and/or you may have risk factors for developing cancer from HPV. They may have recommended you undergo anal cytology or HRA. Just to refresh your memory, those risk factors include weakened immune systems, such as people living with HIV, people with transplants, or people on chemotherapy. Having certain high-risk HPV types, 16 and 18. History of precancerous cells or dysplasia in the cervix, vagina, or vulva. History of precancerous cells or dysplasia in the anus. And anal sex. Do I need to do anything to prepare for anal cytology or HRA? Nope. Ideally, nothing would have been inserted into or placed around the anus within 24 hours prior to the procedure, such as anal sex, douching, creams, medications, or enemas. Taking a dose of ibuprofen or Tylenol shortly before your appointment can help decrease pain during and after the procedure. Do you take any blood thinners? If you do, please tell us. You may need to stop these medications prior to your HRA. What should I expect during the HRA? You'll first be asked to lay on your left side. Numbing jelly will then be applied around and into the anus. A scope with a magnifying glass will then be inserted into the anus, and solution will be applied to highlight the abnormal tissue. For any areas of concern, numbing medication will be injected into the area. Samples will be taken, and any remaining abnormal tissue will be destroyed. How will I feel after? You might be a little uncomfortable in the area, but Tylenol or ibuprofen should be enough to control your pain. You may have light bleeding or spotting, but this should go away within a week. To help with healing, refrain from any anal sex for 4 weeks. No heavy lifting for 10 days. Drink plenty of water. And consider taking stool softeners to keep your stool soft. Refrain from smoking or chewing tobacco. frequently asked questions. What if I'm on my period? This does not affect the exam or results in any way. Just let us know if you have a tampon in place. When will I hear about my results? Results usually take about 7 to 10 business days. You'll be notified through MyChart or over the phone. Will this cure me? Unfortunately, there is no specific cure for HPV. Most people are able to clear HPV on their own, but higher-risk patients may not be able to clear the infection and become long-term carriers. Kind of like colonoscopies or pap smears for people with cervixes, you'll need to keep coming back for monitoring to prevent cancer. Is there anything I should look out for after the procedure? Call the clinician right away if you develop a large amount of bleeding from the anus that doesn't stop, or if you develop a fever of at least 100.4 degrees or higher. We are honored to care for you. Thank you for choosing the James.